Hey, in this video, I'm going to answer the question, should you get your knee drained to help with the knee pain? Now, if you're thinking about getting your knee drained, you probably are dealing with knee swelling, also called water on the knee. And that swelling is just getting out of control. Your knee looks like a balloon. It looks much bigger than your other knee. You've probably lost motion in your knee. You can't bend it very well. And it's uncomfortable to put pressure on too. And this type of knee swelling feels like there's fluid in there. Like if you push on your skin around your knee, here's a knee joint right here. And if you just imagine all the skin around there and you push around the edges of your knee joint, it feels squishy. It feels like there's water in there. It's not a hard, stiff swelling. It might feel hot and warm as well. Those are common side effects of swelling. You may even have a bulge on the back that is often called the Baker's cyst. That's part of this swelling very often too. All of these types of swelling may be associated with different problems like knee arthritis, a meniscus tear, a ligament injury like an ACL tear, maybe an MCL or a PCL tear too. Or you could just have damage to the cartilage, or you may have none of that. You may have gone to the doctor, you may have had an MRI and they told you everything looks fine. You don't look like you have anything torn, there's no arthritis. That might be the case too, but you've got this strange big knee swelling, or you've got this swelling that's just ruining your life right now. Should you get it drained? Well, I'll answer that question in just a moment. Let's just first talk about how the swelling happens, like what's causing it. Why is there so much fluid inside the knee joints? And why is it that a doctor can just take a syringe or a needle in there and pull out all the fluid and then the swelling's gone, or it's a lot better at least. And then it comes back for many people too. We'll talk about that in just a second. Now, what you need to understand is inside your knee joint, the joint capsule, there's a bunch of ligaments that cover up the knee joint, and the lining of the joint capsule is filled with cells that produce joint fluid. This joint fluid is called synovial fluid. There's always a certain amount of fluid in there that serves to protect and nourish the tissues inside the joint capsule, like the meniscus, which is chunks of cartilage on either side of the knee, the lining of the cartilage on the end of the thigh bone, on the back of the kneecap. There's also ligaments. There's other structures in there that all get nutrition from that fluid. That fluid also serves as a bit of a cushion to the joint, because this knee joint, of course, needs to support your weight every time you go take steps and put weight through the joint. Now, that nutrition part is really important because some of these structures in there, especially like the meniscus and the cartilage, don't have the best blood supply, but they do get nutrition from the fluid itself. Now, if you start to get too much pressure through the knee joint, you start to get irritated in that knee joint, usually because of a muscle imbalance. It's something I talk a lot about here on this channel. You can learn more about that on our channel. By the way, there are many playlists we've made here on our channel. They're in the description below. There's links. If you're suffering from a knee arthritis problem, meniscus problem, cartilage problem, many other issues, you can find a playlist full of many videos with tips, exercises, advice, stretches on how to begin to fix those problems down in the description below. And by the way, if you go check out those videos and you feel this has been really helpful for you and you want to show your gratitude, we would love it if you gave us a super thanks, which helps to keep this channel going so that we can keep bringing you great content to help you keep healthy, active, and mobile. Now, back to that pressure in the knee joint. If you have too much pressure going through that knee joint and the knee detects that something's becoming injured, these cells that make the fluid can begin to generate extra fluid in an effort to protect the knee joint, to protect the cartilage, the meniscus, all the structures inside the knee joint. So you start to get this fluid to balloon the joints and put some space between all the structures so that there isn't some long-term or more severe damage. So that fluid development is a defense mechanism to protect your other knee structures. Now, of course, a side effect of all that extra fluid is it's painful. It hurts to just have everything stretch out in the area. It pushes on the nerves in the area, pushes on the tendons, the muscles can get affected. Then also your motion is limited. You can't bend your knee and straighten your knee all the way because the fluid there is obstructing the motion. It also changes the way the joint moves on itself, the mechanics of the joint, so you just can't move normally. The underlying root problem, though, is not the swelling itself. That's a side effect. The underlying problem is that muscle imbalance. There's too much pressure going through the knee joint, and it's causing those cells to overproduce fluid to protect the knee joint. Now that you understand that, let's answer the question, should I get my knee fluid drained? The answer to that is it depends. In the short term, it may help with pain. It may actually give you quite a bit of relief, more than medications. It will probably allow you to bend and straighten your knee better. You may even feel like you can walk and do more, be more active. But in the long term, it's not solving the underlying root problem. And there's a high likelihood that if you don't address that root problem, you're going to get that swelling return. It's going to come back, and the root problem is going to progress. It's going to eventually lead to arthritis if you haven't developed that already, or some other problem like I've mentioned, a meniscus tear, another cartilage injury, a ligament problem. What I would recommend, if I were to see you here in the clinic as a patient and your knee was all exploded, if you're going to start some sort of treatment that's going to address the root problem, please go get that fluid drained. Make sure that you get some relief so that you can begin to do the right exercises. If you're not in a position to start doing exercises, to start doing treatment for this to fix the root problem, you can definitely still go get the fluid drained. But what I would caution you against is getting it drained repeatedly over and over and over again and continuing life as usual after that, because you're going to exacerbate the root problem. You're going to allow your muscles to remain in an imbalance, which is going to damage the structures of your knee. That swelling is happening there to protect you. As painful as it might be, as debilitating as it could be for your life right now, it's protecting you. It's a sign. It's your body telling you, stop, get off your feet. You're putting too much pressure on me. You need to change something massively because I'm not letting you walk on this knee. Now, there's another situation where you might get knee swelling. What if you had surgery relatively recently? Maybe you just had surgery and so you know it's going to be swollen, but maybe it's been 6 months, 9 months, 12 months since you've had surgery and you're still getting swelling. And it's this type of swelling that I'm talking about, that fluidy, squishy swelling around the knee. Well, you might have that imbalance that's still acting on your knee and it's not letting things heal. I see this especially in patients that have had a meniscus repair, a meniscectomy. We also see it in people that have had an ACL repair. They've had a surgery after having a torn ACL. They just can't get the forces off their knee joint, the improper forces, the excessive force off their knee joint. And so the joint remains irritated and those cells in there keep building up the fluid, which keeps creating a swollen knee. In this case, of course, you've got to address the muscle imbalance, but you may have to just take it easy, especially for a cartilage problem like a meniscus tear or a cartilage problem on the end of the thigh bone or back of the kneecap. Healing needs to occur and you might need to just go slow. Even if you get the fluid drain, that doesn't mean go back 100% into the sports you were active in, or going to the gym, or just walking around the block, or doing chores around the house. Even if your doctor told you, because this is the number one thing I run into with people after meniscus surgery, or after any surgery in the knee really, they're doing way more than they should. And they're usually following doctor's instructions. Their surgeon told them, oh, at 3 months you can get back to going to the gym. At 6 months you can probably even do some light jogging. At 12 months for a meniscus repair, you might even be able to get back to jumping, doing CrossFit, heavy stuff. But you might not. You might not follow the normal progression that the doctor expects out of you. You might take longer, but don't force your body through it because you're going to swell. Your body's not ready for it, and it's telling you, if you're swollen, that you need to back off. Now, let's say you get that fluid drained and it comes back. Maybe this isn't the first time you've been dealing with water on the knee or a bunch of knee swelling. That's another clear sign that the root problem, the muscle imbalance that's set up all that extra pressure inside your knee, has to be addressed. If you don't have any chronic knee problems yet, like knee arthritis or meniscus tears, then you're lucky, and you need to listen to these signs now because you're on the pathway to developing knee arthritis problems or a meniscus problem. You need to take the pressure off your knee joint so that you're not repeatedly swelling and over again and just going back to the doctor to get it drained. Many doctors won't drain it more than a couple of times because they know something else is going on that isn't being addressed. It's your muscle imbalance that needs to be addressed, and not every doctor is aware of that. Not many doctors are aware of that at all, and they won't know to tell you to go address that. Now, we've got a program called the 28-Day Knee Health and Wellness Boost Program that's designed at addressing this root muscle imbalance that I'm talking about. You can find a link about it in the description below. Go ahead and go check that out and learn all about it. I'm not going to tell you more about it here on this video. I hope this video was helpful for you. Please drop any comments or questions that you'd like here below, and we'll get back to them as fast as possible. And I'll see you in the next video. Bye-bye.